So welcome back, guys. Here in this particular session, we are in pediatric session, right? We are in the preventive pediatrics mainly. So we will be talking about the growth and development in this particular chapter, right? So if we talk about the growth and development, very important 3 indicators I would like to mention over here in the first place. So indicators we are mentioning, right? And these are very, very important indicators. Again, this is the overlap from the pediatric section. If we talk about the very first indicator, right, that is the weight for height, right? So weight for height, this is the very important indicator or very important specific marker for the acute malnutrition, right? So weight for height is a very specific marker for, so it is a specific marker for acute malnutrition, right? Very frequently asked question, guys, has been repeatedly asked multiple times, right? Second one which we need to look for, that is the height for age, right? Height for age, I mean the weight for height. If I'm talking about that at particular height, what is the weight of this particular child, right? Then if you talk about the height for age, at this particular age there should be some particular height, right? So height for age is telling about that parameter. So basically if you talk about weight for height is telling us about the acute malnutrition in the child, and height for age is a specific marker for chronic malnutrition, Next point over here, what about the weight for age? Height for age we have done that. What about the weight for age? Now weight for age is a sensitive indicator. Weight for age is the sensitive indicator, or you can say sensitive marker for the malnutrition, right? Sensitive marker for overall malnutrition, malnutrition. Fine. So please do remember about these 3 important indicators over here, these 3 important examples, right? Important markers, right? Now we shall be talking about 2 more important things, 2 more important classification. That is, one is the Gomez classification, right? Gomez classification, and another one is the Waterlow classification. Waterlow classification. So let's find out what do I mean by these 2 classifications, right? If we talk about the Gomez classification, it is talking about the weight for age. I mean, it is talking about the malnutrition marker or malnutrition indicator, right? That was weight for age, was telling us about the malnutrition overall. So Gomez classification is talking about the weight for age. It is talking about the weight for age, right? And we are saying that if the expected weight of the baby, right, if the expected weight for age is less than 80%, then we are saying that this is low on the Gomez, right? What do I mean by that? That look over here, this particular Gomez classification, assessment of nutritional status according to the Gomez classification. What they are saying that here on one side they are writing the weight for age, and on the other side we shall talk about the malnutrition. So if it is between 91 to 100, then it is the normal range. If it is in between 91 to 100, then this is the normal range. However, then they have talked about the degrees. For example, if it is 76 to 90, then it is the first degree. Then 61 to 75 is the second degree, and less than 60 is the third degree, right? So if we are saying that if it is less than 80% of the expected weight for age, less than 80% of expected weight for age, right? In those cases, we are saying that it is low on Gomez classification, low according to the Gomez classification, right? So that we need to understand over here. Okay. Second parameter is that about the Waterlow's classification. We know that there is a Waterlow classification. Waterlow classification is talking about both acute and the chronic malnutrition. It means we will be talking about the height for age and weight for height, right? These 2 parameters over here. So let me write as well. We are talking about the height for age, and we are talking about the weight for height, right? So these 2 parameters we are talking about over here, and they are saying that if these 2 parameters, right, if it is less than -2 standard deviation, let me talk about this over here, right? So we are saying that we can see, as you can see over here, weight for height and height for age. These are the 2 parameters which we are talking about in the Waterlow's classification, right? So if we are saying weight for height, if it is more than 80%, then it is normal, right? And if the height for age is more than 90%, then it is normal. If it is less than 80%, weight for height is less than 80%, then it is wasted. If weight for height is more than or equal to 80%, then it is stunted, and less than 80% again, then it is stunted. Now we are saying, look, we are talking about both the things, weight for height and height for age at the same time. Now look, weight for height over here, as you can see, weight for height over here is more than 80%, more than 90%, then it is normal, no problem with that. But weight for height is less than 90%, and seeing that height for age is same, that is more than equal to 90%, but still it will be considered as wasting. At the same time, if the height for age is less than 90% but weight for height is normal, then it is also called as the stunted. So on the basis of height, we are calling that as stunting. On the basis of weight, we are calling the baby as wasted, right? Technical terms, medical terms for calling the baby acute malnutrition, chronic malnutrition, like that. So on the basis of weight, W for weight, W for wasting, we are calling that like that. For example, you can see the weight is lesser but the height is normal, right? But still we are calling that as wasted, right? Because weight component is there, weight is less. If the height is less and the weight is normal, and here the height is less, then it is called as stunted. For the height factor, we are calling that as stunted, right? Simple. Less than 80%, weight is also less, height is also less, then it is called as both, that is wasted and stunted, right? I hope everything is clear, right? So two classification we need to understand. One is weight, one is for the weight for age, that is your Gomez classification, right? And the second one is for height for age and the weight for height for acute and chronic malnutrition, that is our Waterloo classification. Okay, so these two classification we should be knowing that thoroughly, right? Next point we shall be talking about over here, three important parameters, right? Three important parameters, let me talk about them. Now, what are these three important parameters? I am just writing A, B and C, right? If I am saying less than, if I am saying that the height for age is less, I am saying height for age is less, I am having three questions. Height for age, right? There could be low weight for height, right? And there could be low weight for age, right? So in these three conditions, what you are thinking of, what answers you might be giving me, right? So if there is less height for age, right? Height, I told you, we are talking about the stunting factor, and weight, I told you, we are talking about the wasting factor. W for body weight, W for weight, W for wasting, right? So you can remember like that as well. And if there is less height, then there is stunting, right? So over here we are saying that less height for age, height less, so it is called as the stunting over here, right? So this might be called as stunting, or it might be called as the chronic malnutrition, right? Might be called as chronic malnutrition. Okay, fine. If we are talking about low weight for height, weight, W for weight, W for wasting, right? So here we will be talking about the wasting over here. So now here I shall be writing the wasting, or might also be called as the acute malnutrition. Okay. If we talk about, on the other hand, if we talk about the decreased weight for age, now decreased weight for age, then it will be called as the undernutrition. Right? So weight for age was the parameter where we were using the Gomez classification, right? And weight for age is the overall marker, sensitive marker for the malnutrition. So it is the undernutrition. So undernutrition will be talking about. So this is the undernutrition, right? So these three are also very important MCQs, guys. You need to remember them very, very thoroughly, right? Now next we shall be talking about, that is PEM, that is your protein energy malnutrition, right? Yes, you might have covered this in your pediatric classes, right? Pediatrics thoroughly, right? So in the protein energy malnutrition, we are mainly talking about two important diseases. One is kwashiorkor and other one is the marasmus, right? So let me talk about them as well. So here we shall be writing the kwashiorkor, right? Kwashiorkor and marasmus, right? These are the important two important marasmus, right? Two important protein energy malnutrition problems, right? If we talk about the kwashiorkor mainly, let me tell you here that we are having the edema, right? The patient will be having the edema. So comparatively, apparently it will be looking that the baby is not having the problem, the child is not having the problem for weight, because if you will wake the baby, right? If you will be waking the baby, then probably it would be the weight will not be lesser. The weight will be looking like it is normal only because of the edema factor. And why the babies are having the edema over here? Because they are losing the protein. They are having the low protein levels, right? So there is a low protein. So that's why they will be having the edema. We know that if the albumin will be lost from the body, protein will be lost from the body due to the decreasing in the oncotic pressure, the babies the child might be having the edema, right? Okay, so here is the detailed comparison from if you talk about kwashiorkor and the marasmus, right? Here you will be discussing it in the pediatrics in detail. So kwashiorkor is because of the protein deficiency. So here we will be seeing the edema, right? You can see the subcutaneous fat will be preserved over here. Fatty liver will be seen. Fatty liver might be seen over here. Occurs in children between 6 months to the 3 years of age, and the ribs are not very prominent because of the edema factor. So basically, because of low protein, because of the deficiency of the protein, the edema might be seen in these kind of cases, right? So then poor appetite might be seen over here in the kwashiorkor, right? Now remember both of these, right? The kwashiorkor might not be looking the undernutrition, or might not be looking the sick child because of the edema over there. It will be looking the sick child, the edema will be present over there, subcutaneous fat will be very preserved, but still the weight, if you talk about over here, it will be apparently normal. Now marasmus, due to the edema factor, marasmus over here, okay, this disease is caused by due to the deficiency of proteins and the calories, right? Deficiency of protein as well as calories over here. Subcutaneous fat is not present, no fatty liver, occurs in infant under 1 year of age, right? It is occurring in an infant under 1 year of age, right? Ribs are not very, ribs become very prominent. Ribs are not prominent in the kwashiorkor because of edema factor. Here there is no edema, so that's why ribs are becoming prominent over here, and they feed a lot, right? So kwashiorkor, they don't like to feed a lot, but marasmus, they feed a lot. Here is the difference over here. Kwashiorkor, you can see there is a edema, right? And there could be subcutaneous fat will be present over here. Here the ribs are very prominent in the marasmus, right? So normal here, the old man appearance would be looking like, right? Thin limbs, very little muscle or fat, underweight body will be seen over there in the marasmus. Kwashiorkor, there would be the swelling of the leg. There could be the pitting edema as well, right? There could be the pitting edema. Sparse hair, you can see the moon-like face, right? The swollen abdomen, thin muscles, but the fat is present over here. Subcutaneous fat will be present over here, right? This is the normal common difference which we shall talk about in the kwashiorkor versus marasmus, right? Okay, now in case of edema in the kwashiorkor, we are talking about one important classification, that is the Wellcome-Trust classification, right? So for the edema part, we are using one classification, that is the Water Trust classification. You just need to remember the name, nothing else. Water Trust classification is used. Okay, fine. Now, if there is acute and the chronic malnutrition, if there is a combined malnutrition, right? If there is combined malnutrition, then we are calling this situation as combined malnutrition. Then we are calling this situation as acute on severe malnutrition. Acute on severe malnutrition. Okay. So now we shall be talking about the important scale over here, that is the Salter's scale, right? That is the Salter's scale, right? In the Salter's scale, actually, this is showing the weight, right? We are actually, this is used for those children who are not able to stand on their themselves, right? Who are not able to, so it is used for those, children who are unable to stand on themselves, right? Unable to stand on themselves, we are using for those, right? It is giving us the reading, you can see in this particular diagram, right? This will be giving us a reading, and there is a this condition, right? It is actually looking like this, where you can see the baby is hanging, right, on that particular scale, right? This is called as the Salter scale, right? Salter scale. Okay. So this is actually, this was used in the older time. Now we are having the machine, right? Weighing machine. So, just put the baby over there and then you will be getting the weight, right? Electronic version of that. So this is about the Salter scale, right? So it will be used in those children who were not able to stand on themselves. Okay, we were using in those conditions. Second thing over here, it will be showing the weight, right? It will be showing the weight in 100 grams of graduation. Weight showed in 100 grams of graduation, which is its unit, right? 100 grams of graduation on the scale, right? On the scale. Okay, fine. Now we shall be talking about one more important point that you must have talked about, right? That is the Shakir's tape, right? That is the Shakir's tape. Yes, Shakir's tape is used for again assessing the malnutrition, right? and here we are having 3 color coding, right? In this 3 color coding, what you can see over here, this is the Shakes tape. Here you can see that they are writing the MUAC tape. What is MUAC? MUAC means mid upper arm circumference, right? Basically we are checking the mid upper arm circumference, right? Okay, fine. So over here, what are the cutoffs? You can see right here, this is the 11.5 centimeter. This is the centimeter scale you are seeing over here, right? So 11.5 centimeter. Below 11.5, we are talking about the red color. Between 11.5 to 12.5, right? Between 11.5 to 12.5, we are talking about the yellow color. Okay, and above 12.5, we are talking about the green color, right? So what do I mean by that? What we want to predict over here, what we want to tell over here by these color codings, right? So here we know the parameters. So there would be the red color, right? I will be writing it with the red color only so that we are appreciating it well, right? There would be the red color in what cases, right? There would be the yellow color in what cases, right? What do we mean by yellow, and what do we mean by the green color coding, right? Very simple, guys. Here in the diagram you can see that less than 11.5 centimeter is the danger zone, right? Here it means that this is the sign for severe acute malnutrition if it is less than 11.5 centimeter. I mean the mid upper arm circumference, if it is less than 11.5 centimeter, then it will be considered as what? It will be considered as the severe acute malnutrition, right? And what are the limits? Less than 11.5 centimeters, right? What less than 11.5 centimeters? I am talking about the mid upper arm circumference. That is less than 11.5 centimeter, then we will consider that as severe acute malnutrition, that is SAM, severe acute malnutrition, right? If we are talking about yellow color, if it is between 11.5 to 12.5 centimeters, obviously again mid upper arm circumference we are talking about, right? Then in those cases we are saying it is yellow range, that is the undernourished, right? The child is undernourished over here. Okay, the child is undernourished, right? What about the green range? That is more than 12.5 centimeter, more than 12.5 centimeters mid upper arm circumference, and here we will be considering that as normal child, right? Because this is the green range, right? Here this is the normal child, right? So red, severe acute malnutrition, yellow, undernourished, and green is the normal child, right? Okay, please remember Shakes tape, we are using it, right? We are using it after 6 months of the baby, right? After 6 months we will be start using it, that is the Shakes tape, right? And we are actually checking the mid upper arm circumference over here. This is a sensitive indicator which is checked through this Shakes tape, right? Okay, so it is talking about what? It is talking about the MUAC. Please don't forget that MUAC, that is the mid upper arm circumference. So please do not forget that. I am writing as well. This is the mid upper arm circumference, okay, which is checking about this particular area, mid upper arm circumference. They will be, having the inch, this is the tape like this, right, like an inch tape, and they will be measuring the mid upper arm circumference over here, right, mainly that triceps area. Okay, fine, guys. Once we have talked about the Shakes tape as well, now we shall be talking about the SAM criteria, which we have just talked about, that less than 11.5 centimeter according to the Shakes tape, that will be considered under the red category, that is the severe acute malnutrition. So children under the 6 to 59 age group, right, 6 to 59 or 6 to 60 months of age, right, 6 to 59 months of age, here we are having the category, at least this you should remember over here, that severe wasting we will be considering when the weight for height is less than -3 standard deviation. Severe wasting will be considering then when the mid upper arm circumference will be lesser than 11.5 centimeter or the less than 11.5 centimeter, right, or 115 millimeter, right. Bilateral edema, that will be the clinical size. So these are the 3 important features of the severe acute malnutrition, right. So weight for height less than 3 standard deviation, mid upper arm circumference less than 115, and clinical sign, right. So these are your, these are your important, this is our important area, this is the important criteria for the severe acute malnutrition, right. Okay, now the severe acute malnutrition child, they must be sent to the National Rehabilitation Center. Now in the National Rehabilitation Center, we are having 3 phases, right? What is the NRC? As you can see, NRC over here, NRC is the National Rehab Center or National Rehabilitation Center. Okay, in the National Rehabilitation Center, we shall be talking about the 3 important phases over here. In the first phase, we are talking about stabilization phase. Here we are talking about the F75 diet, that is lasting for around 1 to 2 days, right? Where we are giving around 75 kilocalorie of the energy to the particular child, right? This is the starter diet, right? Now after some days, if the child is responding to this particular stabilization phase very well, then we shall be switching to the next phase, that is the transition phase. In this phase lasts for around 3 to 4 days, and here we will be giving the catch-up diet. Please remember, in the first one, in the stabilization phase, we were giving the starter diet, and then in the transition phase we will be giving the catch-up diet, and that will be right. So in the stabilization phase, we are talking about the starter diet, that is the F75 diet. We are giving around 75 kilocalories of the energy. Then in the transition phase, we are giving the that is the catch-up diet, that is 100 kilocalorie we are trying to give to the baby, and that lasts for around 3 to 4 days. Then still, if the baby is responding very well to this particular diet, then we shall be switching on to the rehabilitation phase, right? Where we are talking about 2 to 6 weeks, right? This diet will be lasting for around 2 to 6 weeks, around 1.5 months, and then the baby might be go home, right? The child might be going home over there if responding well, right? So preparedness to feed at home after that, right? Okay. So that is about the National Rehabilitation Center phases. So we are having 3 phases over here: stabilization phase, transition phase, and the rehab phase, that is the rehabilitation phase, right? So this is undertaken by the National Rehabilitation Center, right? Now we shall be talking about some vitamin A doses over here, right? For less than 6 months, vitamin A, it should be given 50,000 international units, right? For 6 to 12 months, 1 lakh international units should be given, and just double if it is more than 1 year or more than 12 months, that this is a 2 lakhs international unit, right? Next day, same age specific dose, and at least 2 weeks later, same age specific dose should be given. Mainly you should be remembering these 3, because MCQ will be targeting these 3 options, right? So more than 1 year, 2 lakhs, 6 months to 12 months, 1 lakh international unit, and even less than 6 months, that is 50,000 international unit, right? So like that, we should be remembering about the vitamin A doses, right? Okay. Now we shall be talking about very important topic, that is the growth charts, right? So now we shall be talking about the growth charts. Okay, if we talk about the growth charts, we are having 2 important growth charts. One is from the Integrated Child Development Services, ICDS chart, and another one is the WHO chart, right? So now we shall be talking about two chart over here. Okay, so growth chart, basically if we talk about, it was actually devised by David Morley, right? It was actually devised by David Morley, and it is commonly used to measure weight for age component. That was sensitive indicator for the malnutrition, right? Weight for age component, right? So here we shall be talking about 2 important one. That is, one is the ICDS chart, that is the Integrated Child Development Services growth chart, right? Growth chart. Okay, so let's talk about the ICDS growth chart over here. This particular image shall be we shall remember just for the color coding purpose. In the very first one, you can see, right? In the very first one, you can see that this color is also not visible over here. I think black one is fine. So yeah, in the first one, you can see the green color. In the second one, this is the yellow zone, and the third one is the red zone over here. So we are talking about 3 zones in the ICDS growth chart, right? So now we shall be talking about important salient features about the ICDS growth chart, right? So guys, please listen to me very carefully over here, right? Here we are taking one general population, and out of the general population, they are taking out of general population of the child, right? Children's. So over here, they are taking the center of the baby, right? The 50th percentile of the baby. I mean generally the mid population of these children, how they are doing. So we will be actually choosing them, and we are deciding the 50th percentile. We are deciding the 50th percentile or the median of this particular age group, right? We have already talked about the mean, median, mode in the biostat, right? So that is the 50th percentile we will be choosing from this children age group, children population, and that's how we'll be taking the 50th percentile as an ideal criteria, right? So 50th percentile, this is the 50th percentile is the borderline for the nutrition. Above 50th percentile, the baby will be having overnutrition. Less than 50 percentile, right, the baby will be having the undernutrition. Of course, that will be if it is lesser than by some points, then it will be considered as the normal nutrition, but below that it will be considered as the undernutrition, right? How is it so? Let's talk about that. So 50th percentile, guys, is an important criteria over here. 50th percentile is taken as the upper limit for this one. 50th percentile has been taken as the upper limit for this chart. As you can see over here, if I will be showing you, this is the chart, it is going like this, right? So this chart is showing you, this is the 50th percentile, right? This is the 50th percentile which they are showing you over here, right? Okay, above 50 percentile, this zone, this is the white zone, right? We are not considering that. This is the overnutrition zone. This is above the nutrition, right? But 50th percentile, below that, right, we'll be considering that. So 50th percentile is the main upper limit over here in this ICDS growth chart, right? Next point is, what about the green zone, right? What about the green zone over here, right? So when we are saying that this is the green zone, as you can see below the 50th percentile, we are talking about the green zone. If it is below 50th percentile and -2 standard deviation, so here we are writing this is the 50th percentile over here, and this one is the -2 standard deviation. -2 standard deviation. So this zone will be called as the green zone, right? As you can see over here as well, this zone is called as a green zone. So between the 50th percentile and the -2 standard deviation, that zone is called as the green zone, and this is called as the normal nutrition zone, right? So we shall be writing that green zone is coming in between the 50th percentile and the -2 standard deviation, between 50th percentile and between 50th percentile and -2 standard deviation, that will be called as the green zone. What about the yellow zone, right? What about the yellow zone? Yellow zone is below the green zone, right? So it will be between the -2 standard deviation to the -3 standard deviation, right? So here we shall be writing that this will be the -3 standard deviation over here, and the zone between here to here will be called as the yellow zone, right? It will be called as the yellow zone, right? So here we shall be writing that between -2 standard deviation to -3 standard deviation, that will be called as the yellow zone, and anything below -3 standard deviation, that will be called as the red zone, right? So now we shall be writing that what could be the red zone, what could be the red zone, right? So here we shall be writing that red zone will be coming below the -3 standard deviation, right? Below the -3 standard deviation, that will be called as the red zone, right? And this will be considered as severe malnutrition. Okay, so please do consider that severe malnutrition. Okay, right. So this is about the ICDS growth chart. Here once again, 50th percentile is the upper limit over here. Between the 50th percentile to the -2 standard deviation, that will be called as the green zone. Between the -2 and the -3 standard deviation, that will be considered as the yellow zone, and between the -3 standard deviation, below the -3 standard deviation, that will be called as the severe malnutrition, that is the red zone over here, right? And the white area, this white area will be for the overnutrition, right? The white area for the overnutrition. Okay, white area is for the overnutrition. Fine. Okay, guys. Now, once we have talked about that, now we shall be talking about one more chart, that is a WHO growth chart, right? So now, after the ICDS growth chart, now we shall be talking about the second one, that is the WHO growth chart, right? WHO growth chart. So in the WHO growth chart, basically it is also known as the road to health chart, right? So some important points over here regarding this one. So these are also known as, WHO growth charts are also known as road to health chart, right? They are also known as Boston health chart, right? Boston health chart, Harvard University, right? Or they might also be known as the field growth chart. Okay, so please do remember about these names also as far as WHO growth charts are concerned, right? In the ICDS growth chart, we learned about 3 important phases, right? The 3 zones were present, green zone, yellow zone, and the red zone. Here we are not having the green, yellow, or the red zone like that in the WHO growth chart. Here we are talking about like we have talked about previously also, we are having the upper curve, right? That upper curve will be considered as the same, that is the 50th percentile. Upper curve we are considering same as the 50th percentile. But if we talk about the below curve, right, if we talk about the below curve, I'm choosing this one, right, I mean the lower curve, here we are talking about the third percentile, right, we are talking about the third percentile, right. Here also we are having the green zone, and that is the only zone we are talking about over here, because there will be the green zone, right, green zone, and then below that will be considered as the undernutrition over there, right. So green zone will be having between 50th to 3rd percentile, right. So green zone will be there between 50th and 3rd percentile, between 50th and 3rd percentile, right, there would be the green zone, right. Okay, now below the 3rd percentile, we'll be considering that as undernutrition, right. So below 3rd, right, and that you can consider as red zone. So below the 3rd percentile, right, we will be considering that as undernutrition zone, right. Below 3rd percentile will be considered as undernutrition zone, right, undernutrition zone, right. If you will be drawing this particular graph, it will be looking like this, right. It will be drawing this particular graph, it will be looking like this. So here we shall be having, this will be the red zone, it is like that, okay, and this is the 50th percentile, right, this is the 50th percentile, and here we shall be having this one like this, right, and this will be the 3rd percentile, this will be the 3rd percentile, okay, and this zone will be actually called as the green zone, this zone will be called as the green zone like this, right. So this is the green zone which we are talking about over here, okay. So this green zone actually is between the 50th and the 3rd percentile over here, right, and this is called as the road to health, this is called as the road to health. So that's why this graph is also called as the road to health graph, or the Poshan graph, or the field graph over here, field growth chart over here, right. Okay, so road to health chart, this is the another name for this one. Between 50 and 3rd percentile, we are seeing that there is a green zone over here. Below that, this is talking about the undernutrition. Below 3rd percentile, we will be considering that as the undernutrition, right. So on one side we are talking about the weight, right, and this is the WHO growth chart, okay, simple, right. So this is the thing over here. So this will be the upper curve, right, and this would be the lower curve, obviously, okay, this will be the lower curve, right. Okay, so between the upper and lower curve, we are talking about 50th and 3rd percentile, there is a green zone present over there, right. So that was about the WHO growth chart. It is a very important tool for the growth monitoring, right, and it is also telling us about the trend. So what is the trend over here, right. Now any kind of child might be present anywhere in this particular zone, right. Some kind of child might be present over here, right, some kind of child might present in the green zone, some child might be present over here, right. But what the important thing is the trend, right. The trend should be on the upper side, I mean the growth of the child should be accelerating, right. If some child is present over here, for example, the chart should be like this, right, they should be growing in further. If still this child is present in the green zone, but if it is presenting in the green zone only like this stagnant zone, right, that is not the good sign. So the trend over here is also the important feature which we can analyze over here. So it is also used to monitor the trend of the growth, right. So it is also used to monitor the trend of the growth. So it can be used to monitor the trend of the growth, right, and this trend of the growth should be increasing, it should be increasing, fine, okay. It is a very good tool for the growth monitoring, right, it is a very good tool for the growth monitoring, right, growth monitoring as well, right. So this was about the WHO growth chart. Thank you.